Welcome back to another episode here on the Heart and Hustle podcast. Our next guest was just a kid when she saw the gap. There was one country with doctors on a call and the other with families just praying for a miracle. That moment, it never left her. Today, we got Miss Sheyi. Did I say it correct again?
Olusheyi, Dr. Olusheyi Lawoyin.
Dr. Olusheyi, I appreciate
Yes.
you. I asked you a question. We got to get straight into it. What's a moment from your childhood in Nigeria or the U.S. that still lives in your gut and fuels your purpose that you still have today?
One of my earliest exposures to what I would have considered a health disparity was during a school break in the city I lived in Nigeria. I was helping my mother collect data at a local state hospital, and we were by the labor and delivery ward. So it's a maternity hospital. Obviously, there are a couple women in labor, very clearly. And what struck me at that age, I was a teenager, was that you're bringing life into this world, and there was
Mhm.
nothing around the mother that was supportive of that. God bless the care workers who I believed were trying the best they knew how to, but the ward was exposed. The beds didn't look comfortable. It was clearly lacking equipment. Um, State hospitals at the time, and in that context, it's very important for me to say in that context at that time, were typically under-resourced and underfunded. And in most countries in the global south, so that's countries with less developed economies, there's usually a stark difference between care offered in private and public sectors. You want the best of the best, you go to private clinics. But how many people can afford that?
Yeah.
Um, so it was at that time that I that experience stays with me because it started out to started shaping the direction that I was going to go with my career in public health and international psychology. I am right now.
So you've worked at places that people really dream of, right? The CDC, the State Department. But was there a moment when you knew if I don't follow my calling, I'll really regret it? Do you remember that time, that moment?
Mm-hmm. Um, well, I'll start here. If you told me 20 or 30 years ago that I would be a health systems leader, I would not have believed you. The idea that I, the idea of that seems so far-fetched and so far removed from who I was back then, or even what I saw for myself. I know that I was somewhat on a path towards a field of medicine. Everyone wanted me to be a doctor. I do come from a family of um, health professionals and people in medicine and dentistry. Um, Obviously, that didn't come to pass. I switched majors in college. Um, I did know that I wanted to do something with my life that improved the dignity of those who may not necessarily be able to advocate for themselves.
Hmm.
At some point, I considered studying law as an option, but I also had an affinity towards business, economics, and social sciences. Um, I took a marketing strategy in business, I mean, college, my junior year in college, that pretty much switched the light on for me. And this is leading up to my time in these other organizations that I've worked in. Um, you were taught to look at a problem, understand the problem, perform an analysis of the situation that has led to the problem, and then provide informed recommendations. And as I was heading into graduation, the only other, I guess, um, course or field that closely resembled that was policy, health policy. Um, and so I applied to graduate school to study global health policy, and I
Hmm.
got accepted into George Washington University. But that experience has taken me from, working in policy think tanks like, the Institute of Medicine in DC, where I decided, I want to go into policy and research and I want to lead. But it was very important for me to learn community health, right, and work in
Hmm.
the field at the ground level. And that's what really led to my time in the Peace Corps. So I applied to the Peace Corps, and I had coincidentally met someone who served in the Peace Corps, and she's doing amazing things, that stem from her time in service in her country that she was assigned to. So I decided to go ahead and apply to the Peace Corps. I was assigned to Namibia, lived there for about 2 years, and then came back, and then started working at the CDC. So it's a mix of progressively a mix of community health. I'm learning what the issues are in real time in the field amongst the people that are, engaging the health system and engaging the policies that impact them. And then I also had the experience of the CDC where I was able to, you know, kind of switch hats when I had to, and also learn from people who are doing incredible work as well. Um, Staying true to my calling has been, of course, is tricky. I think there is a stint in my career where I decided, this is right after business school at Emory. I was at a business school where I decided to, you know, go into consulting for 5 minutes. And
5 minutes. Okay.
it lasted about 5 minutes, for about 5 minutes, because that's what you did. You get an MBA, and I don't regret the experience, but I think it solidified the that part of my journey where I knew without a shadow of a doubt that I wanted to be in community health and I wanted to be a health systems leader. And I had, my trajectory had been going along that way, and it was okay to stay that course. And I've been
Mhm.
on that course ever since.
And now you're leading one of the oldest community health organizations, LA. Like, what 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 did that community teach you that no degree ever could? Because you did mention that there was just so much that you've learned from this organization as well. Because every job, I always say there's something to learn and every single step of the way. You mentioned that 5 minutes. There was 5 minutes of learning, right? And now
Hmm.
you're in this space where you mentioned helping a pretty cool community health that people don't know it probably if you're not from LA it exists. So if you can just kind of talk about it, what you guys do,
Hmm.
give some more insight on that, but also what did you learn from it that no degree can teach?
Yeah, so there's such a powerful story behind Watts Healthcare's beginnings. So, following the Watts riots in 1965, a task force was set up called the McCone Commission. And they issued a report that identified the root causes of the riots. And, some of them were high unemployment, there were poor schools, and related inferior living conditions that were endured by Black and African American residents in Watts. One of the recommendations among several for addressing these problems included upgraded healthcare services. So the history books tell us that most of these recommendations were actually never really implemented.
Hmm.
However, the Watts Health Foundation was born a couple of years later after the riots to advance quality healthcare delivery for the Watts community. Um, One of the findings in the McCone Commission report suggested healthcare in the area bordered on third world conditions at the time, and most residents had to be bused to other parts of Los Angeles for proper care. Um, so when you think of that really powerful story, and also the fact that Watts Healthcare is considered to be one of the leaders in the community health center movement. I mean, we're 2 3 years shy of 60 years old.
Wow.
So we've been doing community health and equity work for that long. Um, and now more than ever before, we're aligned with our mission to, improve the health and well-being of individuals, families, and the communities we serve by ensuring access to quality and culturally sensitive care. Culturally sensitive because we know that health doesn't exist in a vacuum. There's so many drivers of care in the environment, and culture being one of them. We want to make sure that the care we provide is responsive to the needs of our community members. Um, for those who are familiar with Los Angeles, we serve Watts, Compton, Willowbrook, Southgate, Wilmington, Crenshaw, um, and we're well known across the country. So I'm really proud to be part of this organization. One of the things that drew me to Watts Healthcare is community. Very community oriented, very, very community oriented.
I
And
ask you, you've been in this space for a very long time.
mhm.
What do you remember? A story does it come to mind that makes you think, man, I'm happy I do what I do? Is there a story that you recall in your career that just allows you to feel like, man, I'm in my purpose?
I think it's every day, right? So for me, I'm an international psychologist by training, and which means that I apply psychological science principles to global health issues. typically at the population level and within the population's context. So I'm looking at ways to understand and improve the health and well-being of underserved populations and making sure the health systems are responsive. Um, I go back to culturally appropriate and culturally sensitive. There is one particular incident that it was so profound for me as I was, engaging some of the staff members. There's a
Mm-hmm.
patient who wasn't taking her medication for some reason, and I guess her team was just kind of concerned about that, and they didn't understand why she wasn't taking it, and decided to ask a different question. The question was, okay, you're not taking your medication. What's going on? Tell us about what's going on at home. And when we started
Mm-hmm.
along that path, we came to find out that she lived with her son, and she couldn't take her medication because every time she had to wake up in the middle of the night to go use the restroom, it bothered her son. And she was so concerned about that, she stopped taking the medication because she didn't want to bother her son.
Mm.
And the light bulb switched on for all of us as we listened to her. And we thought through a different plan. We thought to bring the son in to engage him in the conversation. So I, things like that bring so much joy because you're providing a solution, but you're also getting to hear more about what's going on. And it's something as simple as, hey, let's bring the son in and figure out a plan, help him to understand what's going on with his mother so that she can stay well, but also recognizing that families are important culturally. People respect that, and they want to do what's best for them. So I think being able to incorporate those aspects of people's lives into the care delivery, always a joy for me. But that particular story stood out.
You think growing up and your early childhood really gives you the empathy to deal with some of these patients today, what you've seen in your past as a young girl and thinking of where you're at today, that you think that's provides you that empathy to really help others and give you all to it?
Oh yes, a lot of that has also to do with the fact that I spent, I'm a second generation American. I am Nigerian, ethnically Nigerian. Nigeria is a country of my heritage. I also spent my formative years in the Middle East as well. So I was also a third culture kid experiencing a culture that was very different from mine and my parents. Um, but this was a big part of my upbringing that has played an important role um, in my personal and professional development. Being able to understand people of different cultures, being able to understand people with different orientations. Um, the lens through which people see life is not always the same. Um, and it's important to understand that, being able to provide proper care. I think now that I'm a professional in this field, I apply a lot of, how I was raised and my experiences growing up. And, you live in different, I just gave you a story of working at a local state hospital, working, well, with my mother, helping her, and experiencing the local state hospital that was underfunded, seeing a lot of that as well. Um, and wanting more for, people who may not typically have access to service that would offer optimal care. It was really important to me just because of those experiences. Um, I don't know that there's any one incident in my childhood that made me go, except for these stories that I've shared, that made me go, um, that made me just really learn empathy. I think it was just a
Mm-hmm.
continuum across my childhood into my teen and even into my adult years. Just learning people, learning how to support and serve people. I think that's just ingrained in me from childhood.
No, no, I agree. Life experiences, wherever it may have been, as you mentioned, doing a little traveling and experiencing other cultures, definitely will help where you're at today. Because that's kind of a melting pot. When you talk about the Crenshaw areas and just the areas that you got served, that is very a melting pot. So having the experience you've had all these years, definitely you're the right fit to then go to Watts and provide that. But I also think that there's also something in you being representation to people that probably never would have seen someone like you. I think it's huge. I think one, you're a black woman, right? that's it. You're a black woman, and there's already a stigma against it. But you show up and you show with so much grace, so much empathy. I mean, look at you today, right? Like representation matters. Do you feel that you have this like almost weight on your shoulders to show up and be present and lead with presence? Like, where do you think you stand as a young black woman?
You know, I I'll tell a little story. I've been very fortunate to have had mentors and had people in my life who've, I like to say, saw me before I saw myself.
Mm-hmm.
They were able to see something in me, and they wanted to make sure that I saw it as well. And you know, they come in. I've had, you know, my dissertation. Someone in my dissertation committee was my first boss who pushed me to the forefront and said, "You're going to do this." And I wanted to retreat, and she pushed me. And I've worked with just amazing people. Thinking about my time at Emory Healthcare as well. Um, I strongly believe that early exposure often to opportunities that will help young women of color see their future selves is key. Um, my first day onboarding at Watts Healthcare, I was sitting in a training session with a few people, and a young lady who was coming on board as a social worker just kept staring at me, and a little uncomfortable. I was like, okay, so what's going on? And she eventually approached me. This is when we had a break, and she said, "You know, I'm from this area. I've never seen a black female COO before, and I promise you that as that there was a shift for me after
Mm-hmm.
that interaction, um, and I became more aware of my role, and and being an example, and really thinking, wow, I have to present this role very differently, right? I want to do well in my job. I want to do well for the organization, and do well by the legacy of Watts Healthcare, but also realize that people are staring at you, and
Mm-hmm.
staring at you for the reasons that this girl mentioned. I've had several comments even after that where people have shared similar sentiments with me. Um, so being very aware. I know that people say be yourself. Yeah, you be yourself, but you also have to realize that people are looking up to you as an example. And I think that's been very important for me to um, has been very important to me, especially since that day. Some people might see the value in it, some people may not. I share stories where I can. I make sure that I'm speaking to young
Mm-hmm.
women of color as well when I meet them. I'm sharing. I've been able to share opportunities and stories about my background with others and my trajectory with other people, and I'm a huge advocate for that. I think
Mm-hmm.
that if people are able to see more of what they their future selves could look like, I think it's easier for them to navigate the spaces they're in, and probably navigate a path. And I want to
I'll
make
add
sure
on to
that I'm
what you just
part of
said.
that.
You said when you see young women, right,
Mm.
you pour into them in a sense. So for
Mm-hmm.
girls that are watching this, what's the story you wish someone had told you about black women in leadership that you can share with those young leaders, especially women leaders that are wanting to get into this space, but also may have a little bit of fear?
Oh yeah. Um, lead with knowledge. Lead with knowledge. Um, you know, I always make sure this is just part of what I do, but as best practice for myself and my work. But it's very important. Lead with knowledge. You have nothing can be used against you if you're able to lead with the knowledge that of your work
Mm-hmm.
and the knowledge that you deserve to be in the space. If you're in the space, you deserve to be in it, right?
Mm-hmm.
Um, you're always going to have naysayers. I'll give an example. I remember early in my career, I had a presentation at a university, very, very early in my career. Um, and I was nervous, but I knew my work and I knew that what I had to share was important. So I was fine. And I was being introduced a few minutes before I was supposed to speak. I was being introduced to some of the faculty. And everyone's kind of looking forward to me speaking and what I had to say. And one person said, "Oh, you're young. Oh, you look young. What do you have to share?" You know, it's like
Yeah. Already
very
brushed you
matter of
off.
fact, like
Yeah, yeah.
I have like 30 years on you. What are you going to tell me? And I walked up a few minutes before I started to speak, and it did affect me because I
Yeah.
fumbled a bit. um, and I guess what I want to tell, young black women and just young women really, um, who has, who have a purpose and a goal, and who are able to identify that, is you will have naysayers along your journey. It's going to be that person that makes a flippant comment. It's the person that has judged you as you walk into the room, or the person who has assumed they know you as you walk into the room. You're going to have that. That comes with the territory. You lead with knowledge. You're anchoring in the confidence that you have a goal that is bigger than the space you're in right now, and that needs to be your North Star.
Mm-hmm.
Definitely for me personally, my faith has been, big part of just my journey, and being able to just entrust, that purpose and mission, to God, and letting Him lead is important. Um, Leading with knowledge.
Yeah.
You be the best in your area. Strive to be the
Yeah.
best in your area. Strive towards being the best in your area, and allow people to see that. Lead with that.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Yeah. I mean, I would just add on to what you say for any of those leaders that are watching is one, know your worth. I always say that. Know your worth. You have so much value. You bring value to a room before they even knew you had value, right? And that's for you. You had value. Someone tried to take that away from you, but you brought value to that room. I'm pretty sure someone took something away, but it's also never let someone dim your confidence. We work so hard to be confident, and you mentioned the word confidence. That's the only reason I tap into it, because you have to have confidence. As a leader myself, as a male leader, when it comes to us being, I think, a minority or even sometimes being young, people look at us and they almost get intimidated. And that's why they do what they do, right? Because they see someone like us that comes across very confident. We show up. We're very just happy, excited. And I would even share a story for those that are watching. It's going to always happen. I remember when I was 22 years old. I was already a general manager, and I happened to have a unique location. I worked inside of a science center, and I will never forget how this woman treated me. She did not know me, but one time we were sitting in having a meeting, and I'm guessing she had an assigned seat. She was the only person that had an assigned seat. Okay, so she wasn't there, so I sat in that seat. I didn't know it was her assigned seat. I just sat in the open seat that was there. So as she showed up, she's walking up. Everyone kind of looked at me like, "You're not gonna move?" And I'm looking like, oh, I was a smart ass, I was a little young. Oh, we have assigned seats? And then she, they was like, well, she normally sits there. And she's like, this is her response. I'm like, she says, don't worry, he's just young and immature. I looked at her, I said, well, at least I showed up to this meeting on time. So you already know how she felt. Ruffled the feathers, right? And I had to like undercover boss. She hated me pretty much to the point that she went back to the company and says, if you don't remove him from this location, we will not renew your lease for this location. So they had to pull me out, right, and pull me somewhere else. And I really felt bad because I felt disrespected by the company. It's $1 million location that I opened up. that I worked very hard to do this, but because someone else didn't like me, that they took me out. But that's how business is. But you'll have places, and at that moment, I could have just left. I could have felt bad about it. I could have felt all these different things. But I know who I was, and I knew what I brought to the table, and I knew that it wasn't a decision based off my performance. It was a decision based off someone that didn't like me. I'll give you another example. When I was in a nonprofit, and people wanted me to be vice president, but the president at that moment, sitting president, says, I don't, he's too young. We can train him and mold him, and then maybe one day. But he didn't even know me. He didn't know what my talents were. And today I actually am president because he decided to walk off, and I was the other person to take on the responsibility. But it goes to sometimes you just gotta be patient as well. God, you mentioned that God is going to test you. And you got to continue to have faith, especially when you know you're doing what's being called upon you, right? And for me, it was being a leader, and it was showing up even when people counted me out. Because you will always, there's going to be certain rooms, a man will count you out. Someone, a different race will count you out, all because of the color of your skin or your orientation, as you mentioned a little earlier, or your sex, whatever that may look like. So for any leader that's watching, always, you mentioned it, Olusheyi, it's to be yourself, have confidence, bring the knowledge. We are so educated, and people already belittle us before we even walk into a room. But use that as your fuel to really show them, oh, you thought I was what? Like, add that into those stories and into those speeches, into those talks that you give, because there's something in that. And I'm happy to see young leaders like yourself in the space where probably there's not a lot of them. And sometimes may feel lonely that you can't call somebody else like, hey, what are you doing through this situation? Do you have that?
Yeah, yeah. So any leader will tell you that it can be a lonely journey. Um, you're learning. You're learn. I will say you think you're learning a lot early in your career as you're growing, and then you become a leader at any level, and
Hmm.
you realize that you're 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 required to learn even more.
Yeah.
Um, you're learning it. You're learning how to lead people. With grace and towards a mission. You're learning how to confront issues.
Hmm.
You're learning how to make decisions. You're learning so many different things every single time, and it's always good to have people you can talk to, who you can relate to. I go back again to my time at Emory Healthcare. I look very fondly at that experience because it taught me, I will say it taught me boots on the ground operations and really how, health systems leadership. But I also had, mentors. I had assigned mentors. I think it's very important for me to say that, mentors don't always have to look like you. You really need people in your life who genuinely want to get to know you and who genuinely want to get to see you succeed,
Correct.
and you want to remain open to those opportunities. And very importantly, a good mentor, shows you who you are and make sure that you see it. And I've had individuals like that over the course of my life, and even as I was learning leadership at Emory, I had that as well. Now, here in this current role, it's sometimes it's peers. You're reaching out to your peers and saying, I just can we just talk about stuff. Because you walk around as a leader, and you are, I call it the burden of responsibility. You you have to process a lot of things outside of the current situation.
Yep.
You have to process things away from people you're leading. You have to figure out the mess elsewhere, but show up. You smile and wave, smile and wave. Um, that's a leader. There are opportunities to be vulnerable, and to reflect that. I think there, sometimes people that look up to you as a leader need to see that, the sense of that. But for the most part, you have to display um, decisiveness. You have to display calm, because again, going back to what I said earlier, you're a mirror. People are looking up to the leaders. If my leader is scrambling, they're going to start scrambling too.
Yep.
So being able to reach out to people who you have close affinities with, is very important because it helps to sort of helps you go through some of these things you experience as a leader a lot easier. I think it's really important. Self-care for leadership, I think that's really important to have that.
And you mentioned self care. That's exactly what I want to kind of go to because as a leader, we all have that imposter syndrome at times as well.
Mm-hmm.
Because no one's really showed us how to lead for ourselves while leading for others. So sometimes
Mm-hmm.
we're trying to pour in to somebody else's cup and we have nothing to pour into because we're exhausted, we're leaders. And we have to put on this mask as a CEO, as a CEO, as an entrepreneur, whatever that may look like. So what does that look like when you talk about that self-care, making sure the mental's good, right? The mental health is so important in this space as well because you can start talking to yourself in a negative way and starting to believe it. But what are you doing? What are those
Mm-hmm.
steps that you're taking on that really kind of help you get and overcome these moments?
Um, Guarding your heart is important. Guarding your heart is so critical. And what do I mean by that? Um, Once you open up the door, like I mentioned earlier, that you're going to have naysayers. You're going to have people who make these flippant comments. You're going to have
Hmm.
situations that will test you. You know, you have to be um, you have to be aware of as a leader. You have to be aware of you know those little things or those little I call them gates or doors that once open can really derail you. You have to be aware of what those issues are and what those events might be, and guard yourself against that.
Yeah.
I have some people tell me, um, you know, they, they when they get stressed, they take walks. Um, they don't. There's certain things they don't listen to. You develop such a thick skin. You have to develop such
Yeah.
a thick skin because people will have their opinions about how you should be leading or not leading. And it's all opinions, and they have every right to have that opinion. But what is true and what is edifying about what you're supposed to be doing in your role, that's what you want to focus on because, people are going to say whatever.
Yep.
Um, so I think guarding and making sure that you're sifting through and you're filtering and making sure that those things that are actually going to build you as a leader and maybe critical but will help you grow are those things that should stay with you. Everything else is noise, and that takes practice, right? That takes a lot of practice to be able to get to that point. Um, so guarding your heart, um, making sure some people say, hey, after a certain time, I don't respond to emails. I don't, because if you're constantly on a go, 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 and you don't have time to recharge or refresh, um, yeah, sure,
Pretty much no
you're working,
work-life balance.
yeah, you're working hard. You get to define what that looks like for you. Maybe there
Hmm.
are some things you have to do late into the night, right? Um, but then you have to decide where am I just not very useful to doing all this work? Where am I just not useful anymore? Not only to others, but to myself. Shut it
Hmm.
down and get back again to it. I think each
Hmm.
individual gets to define what that looks like. Some people will say after 5, no more emails. Some people say on the weekends, I'm not looking at emails or I'm not working. Um, Everyone gets to decide that, but you have to be able to recharge, and you
Hmm.
define what that looks like. Um, that's what I would say.
I love it. Okay. All right. I want to go
Mm-hmm.
ahead and take this to a different direction. You're in a space of healthcare. We know that there's so much happening right now when it comes to government fundings in the healthcare space, in the nonprofit space. A lot of people are being affected. People don't want to show up now to the hospitals because of a fear of what may happen. Maybe ICE shows up. Um, but then there's some people that are when we just come to like staffing. Let's talk about the staffing because we know that pandemic we lost so many people in this space of healthcare, nurses, because maybe they felt overworked, maybe they felt undervalued. But I think we're in a space now that people can come back to the healthcare space, do what they love more, and all the admin, all the tasks on the back end is being automated by AI, or at least some organizations are implementing this. So, what does Watts look like when we talk about AI? Is there something that you guys feel has really helped you guys scale by implementing some AI? Are you guys looking around the corner and testing the waters? What does that look like in your space?
Well, I'll say more generally, I think there's going to be a role, obviously, a role of AI in health, in healthcare. Um, Looking at AI towards automation, but also to help with
Hmm.
efficiencies, improve efficiencies. I think, as we, like every other, health system ventures into that space, looking at how to create efficiencies and going back to quality care, making sure that, we're providing care, value-based care. You do want to make sure that you are efficient, and efficiencies look like improving the workflow, you know,
Mm.
making sure that patients or populations receive this, quality care, maybe a lot more quickly without a lot of the waste. So I think cutting out a lot of the waste is, where we'd be looking, um, as an organization, like most other health systems. Where can we cut back on the waste, so that on the waste in the processes, in our processes, so that we are focusing on what is going to bring the best value
Hmm.
to our patients. That's what we'd be looking at, because that
Yeah.
aligns with our mission.
Have you
Um,
guys already implemented some sort of AI, or are you guys just looking ahead and trying to figure out what's best to incorporate, integrate?
Looking ahead, we're looking
Hmm.
ahead. You want to be careful too, right?
Yeah,
It's
yeah.
you don't want to um, jump head into that foray without really understanding it and understanding um, what the impact of it would be. So it's a good exploration phase right now, um, and specifically looking at efficiencies. How do we become a more efficient system, and also how can we be more supportive of our staff, right? So that they are um, using the system well. Someone once told me it's not always the staff, and maybe the tools, right? So standardization is going to be really important, and AI brings that benefit, um, so that people are learning to do, the same thing every time to create the efficiencies that we're looking for.
Hmm. Are you a user of AI like ChatGPT or anything? Have you been dipping
Oh
and
yeah,
dabbing into it?
yeah. I mean,
Yeah.
people people use. I think one of the most common tools is ChatGPT, right?
Yeah.
Yeah.
You'd be surprised. I was talking to a gentleman. I was like, "Hey, you use ChatGPT?" And he's like, "No." And I showed it
Oh,
to him. He's like, "Do you have to pay for that?" And I'm like, "I mean, there's a paid version, but you could use the free version." But it is
yeah,
true. I think that some people are getting into the ChatGPT versus
yeah,
Google before Google now. But you'd be
yeah.
so surprised how many people I still talk to that it's afraid to put anything in AI because they just, as you mentioned, right? There's a safety
Mhm.
issue. There's
Mhm.
what do I put, what not. But in the healthcare and the nonprofit space, I mean, to help you with emails, help you write letters to other people. Like, I mean,
Mhm.
I use it
Mhm.
truly. I use it every day. I'm like a personal assistant, to be quite frank.
Mhm. Mm.
Research becomes so much faster, you know. So
Yeah.
I truly
Yeah.
enjoy that.
Yeah.
Um, I ask you another question as we start wrapping it up. When did you learn that listening is just as powerful as leading? Because I feel like you're a really good listener and you're a really good leader, and those are two great qualities. But when did you learn that?
Um, I think listening is a big part of my personality too. Um, I am curious about people, not in a strange way, but in a way, I think it's really important to try and understand where people are coming from. I think the worst thing is if you can help, if you can't, can help, is to not feel, you don't want to feel misunderstood. You certainly don't want to misunderstand people. If they mean X, you want to be sure that you understand that they mean X and not Y,
Hmm.
because it impacts the way you interact with them and how you perceive them, and you want to make sure that you have the right information. So listening as a leader is really important. I think, you know, a mentor taught me that, uh, one of the good signs of a good leader is someone who's able to sift through information that they're learning from others, right? And about who they are, and leading them based on that. Um, I'll give you an example. An employee who, you have an employee telling you, sharing stories about how they start their day, if they have children, how they incorporate, taking care of their children into their lives. You're listening for certain things. You're listening to, how does this person organize? stay organized? How does this person, you know, are they proactive? You're listening for these things. They're not telling you. They're not coming and telling you. You're not asking them, are you organized or not? You're not asking that question, but you can listen for it when you
I see it.
are
Yeah.
really interested in hearing their stories and what they share about themselves, and you're incorporating something like that. And okay, well, maybe I'm getting from this individual that maybe when they start the day, they're not particularly organized.
Hmm.
I kind of need that organization here. How can I support that here so that they're growing in that space and I'm getting what I need from them, get the best of them? Sometimes it's, maybe giving reminders to, on task, to keep them on task. And I've, I give that example because I've experienced that in my, personal interactions, and it, I, it was made the difference. It was a night and day difference, and the person felt so understood and so supported. And I, I'm helping them grow in that area. I hope that I am, but I'm also making sure that it has to be done on time. So listening is not just about, it's really about getting to know the person and getting to know how best to lead them, which may be different from another person, the way you lead another person. And that's really important to know as a leader.
Yeah.
Mm-hmm.
Yeah, when someone feels heard, seen, recognized, all that makes someone feel like they want to come to work more, right? Like
Mm-hmm.
the loyalty, all that. So yeah, great leadership. See, that's why we had asked that question, because I knew that you're going to bring that out. But I also want to talk before we head off into that blind question, get you in the red hot seat. I really want to talk to the woman and all those women that are of color and they're leading in a health organization one day. If they could hear your voice, what would you actually want them to know?
You are, I believe that everyone is placed on earth for a purpose. Um, that is the essence of life. And, that essence is making an impact on others and others around you. There's a lot of wisdom in taking the time to develop your skill set. So if you have a goal and you know that you want to be, I'm going to say, let's say you want to be a lawyer someday. At some point, that was an option for me. I thought I was going to go into law.
Hmm.
Um, Sometimes I still wonder about that, but I think that ship has long sailed. Like we're done with all that. But for example, let's say you want to be a lawyer one day. Think through the skills that you'll need to get you there, and that you need to cultivate to be the very best, best attorney,
Yeah.
best advocate, and develop those. And don't rush. Comparison is a thief of time, a thief of your emotions, a thief of your joy. Don't get into the comparison game. Um, if you feel that you are being slighted for reasons beyond your control, um, based on anything that's innate to you, um, test it first to see if it is actually the case.
Hmm.
Um, the last thing you'd want is to be reactive, right? You want to make sure that you're developing the skill of um, sifting through your perceptions as well, because that will serve you very well. That
Hmm.
will serve you very well. Um, Taking the risks. If you see an opportunity, if someone gives that to you, and that opportunity can come to you and from anyone and anywhere, if it's going to serve you well, take it. It may be hard. I mean, I took on a task. Someone gave me a data set. Again, early on in my career, someone gave me a data set and told me I had to present it 2 days later at this mini conference. And oh, by the way, you have to analyze the data. And oh, by the way, you have to use this software I've never used in my life. I had learned that software in 2 days because I was going to be presenting at that. I was going to be there,
Hmm.
rain or shine. So it meant that I had to figure this out. The weekend, I figured it out. I've stayed and holed myself into the room and I figured it out. Don't be afraid of those opportunities. It was very overwhelming and daunting. I made it through. But take those opportunities. Um, and again, I go back to what I said earlier, lead with knowledge. Lead with knowledge. Don't lead, when you walk into a room, don't lead with, this is what I look like, this, oh, I'm young, or I'm a person of color, oh, I have only been doing this for a year. Don't lead with any of that because it will derail you, right? Guard your heart. Lead with, I'm in this role. What do I need to know to be the best in the room that I'm going into right now? And that's what you should focus on. And people respond well to that. Hmm.
I love it. I love it. Are you ready for this blind question time?
Okay.
It's pretty good. It's pretty easy, I would say. What truth about equity or leadership do you believe now more fiercely than ever before?
Wow. One thing I believe is that, especially in health equity, um, systems. You want to build I'm a health system strengthening. Um, that's my area of focus, and I think historically, I think we haven't really focused on context,
Hmm.
um, in equity and health equity, meaning that um, we haven't really looked at historical, economical, cultural, social, political factors that really influence the way that a community engages the health system.
Mm.
And I think now more than ever before, that's so critical. I think I learned that during the pandemic,
Yeah.
right? During the COVID-19 pandemic, um, that that was so pronounced that, there's so many, the health system, the traditional health system would have to die and the way that we deliver care would have to die for us to be able to create a delivery system that, um, optimizes, health and social well-being. You
Yeah.
have to figure out the context in which a person experiences their environment in order for you to provide equitable care, and in order for you to ensure that they are actually well.
Mm-hmm.
Hmm.
Mm-hmm. No, I hear you on that. We could. That'd be a whole conversation, a whole nother 30-minute conversation,
That is
really.
loaded.
I was about to open that. I was like, you know what? We got to wrap it up. No, that's a whole situation that I've been talking to other leaders about. But I ask you, what is your blind question for the next lead that we have here on the Heart and Hustle?
If you could give your younger self one piece of advice, what would it be?
All right, all right. I love it. I love it.
Hmm.
And what can people find you if they want to connect with you directly, or what is the website for the organization so people want to find out more in the area?
wattshealth.org. That's our official site. I'm also on LinkedIn. Um, and I would say that's my well, primary social media, professional social media page. Hmm.
Yeah. I love it. Well, I thank you so much for your time. I know you're a busy person, but to take this time and just really share the knowledge, but also share some leadership skills to those that may be watching. I always say reputation matters. So anytime I get to see someone like yourself across the screen of color more than anything in these spaces, it doesn't happen often. So I always appreciate when I do get to see it and I get to just kind of hear how you've navigated the system in a sense, because it is very challenging, when you don't see people that look like you. It's like, who do I go to even ask? But as you mentioned, to just always show up with knowledge. And I think that's the best thing that we could take away from here. Guys, if you guys enjoyed this, make sure you guys do like, subscribe, and comment. If you guys want to see more great leaders, don't forget, it's right here on the Heart and Hustle podcast. My name is Ephraim. This has been Olusheyi. Thank you so much. We'll catch you guys on the next one. Laters.
Yeah.